fill-in. She filled in for whoever left, I can't remember. So. Okay, so we're welcome to the Board of Health meeting of July 11th, 2022. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's June 16th, 2020 signing of an act relative to extending certain COVID-19 measures adopted during the state of emergency, including the extension of this March 12, 2020 order suspending certain provisions of the open meeting law, general law, Chapter 30A, Section 20, until July 15, 2022, this meeting of the Chatham Board of Health is being conducted in person and via remote participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling 1-508-945-4410, and the conference ID number is 739-654-282#, or join the meeting online via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Channel 18, despite our best efforts, we may not be able to provide for real-time access. We will post a record of this meeting on the town's website as soon as possible. Now I'd like to turn the meeting over to our chairperson, Dr. Noble Hanson.
It shall be the policy of this board to conduct its meetings under the open meetings law so as to encourage public participation whenever time permits and as part of agenda item discussions. Okay, so today we have 4 items, but first we'll make sure we have a quorum, which we can take a voice vote, I think. Ron, Carol, and myself are here. Okay, so we can move ahead, and item number 1 is a variance hearing for Brian and Susan Daugherty, 55 Captain's Walk, and Clark Engineering, I think, is representing them.
Yes, David Clark Engineering. Can you hear me okay?
Yes.
Great. On behalf of the Daughertys, they have plans to demolish the existing dwelling and build a new dwelling, and we're before you today to ask for an extra bedroom with the use of IEA technology. The existing dwelling is a permitted 3-bedroom house with a 3-bedroom Title V system. The new house is proposed to have 4 bedrooms, and we're adding IEA technology. As always, a 4-bedroom system with IEA technology introduces far less nutrients into groundwater than a 3-bedroom system without the IEA technology. And pursuant to your nitrogen loading regulation, we're before you to seek approval of this project.
Okay, we have a set of the plans for the house being considered, and then we'll talk about Judy's recommendation in a moment. Are there any questions or comments from the board on the variance? Dick?
In the basement level plan, there's a game room with a bathroom attached, and I'm trying to figure out how you get into that game room. Is there a door from the den into the game room? The only entrance to the game room I see is into a mechanical room or through the bathroom.
I don't know the answer to that. Looks like they left a door out of the floor plan.
Because that would have to be at least a 5-foot cased opening, or it would be a bedroom.
Well, it's in the basement, so it can't be a bedroom.
Oh, it doesn't have any window.
Yeah, Judy, can you just go over
Oh,
what in a basement room, what disqualifies it as a bedroom?
It has to have a certain amount of natural light and ventilation, which means a window which meets a certain size for lighting, and also egress, certain height off the ground, and the size of the window. So that inside area wouldn't meet that because it's completely underground and there's no windows. It's an interior room, so to speak. And then the den part, although it looks like they're putting some wells in there for egress. Because it's kind of a common area, you come down from the basement, we don't usually count those areas as bedrooms.
Judy, I am here. Rick Roy is on. Can you hear me?
Yep, hi, Rick. Rick is the builder.
Right, sorry about that. Dave is correct. That game room does not have a door drawn into it. It should be a 5-foot opening
From the den?
from the den.
Okay.
And the window wells are more for light, so that they can get natural light down into the basement.
Okay.
Yeah, Dick, I don't think you finished your comment?
No, that answered my question.
Okay. Any other comments from the board on this?
I don't see any problems.
Okay, and Judy has sent out her opinion that she would approve this since a 4-bedroom with the IA technology will put out less nitrogen than the 3-bedroom traditional septic that it already is allowed. So,
And then also this is going to be going for ZBA, I believe. Is that true, David, this week or?
I think so. Rick, you still on?
Yes, I'm still here. Yes, it goes for ZBA on Thursday.
Thank you.
Okay.
okay, can I get a motion to approve the variance?
So motion to approve.
And a second?
Second.
Would you like me to read the conditions?
Yes, please read the conditions.
Okay, so it's the standard 9 conditions. The applicant should restrict the property to a maximum of 4 bedrooms and record the restriction at the Barnstable County Registry of Deeds and submit a copy to the Board of Health. The applicant shall sign a covenant with the board agreeing to comply at such time as the town, through its Board of Health and/or Board of Water and Sewer Commissioners, directs the connection of this property to the municipal sewer when it becomes available. The covenant and the 4-bedroom deed restriction shall be recorded at the Barnstable County Registry of Deeds. Throughout the life of the system, it shall be under an operation and maintenance agreement, and the agreement shall be for at least 1 year and may be with any Mass certified operator of the appropriate grade that has received training by the company on the operation of the system. Effluent from the system shall be monitored at least twice a year for the first 2 years, preferably May and October, and the effluent shall be field tested in accordance with Mass DEP standard conditions for secondary treatment units certified for general use, revised March 20th, 2015. In addition, a lab test of the effluent for total nitrogen to meet the performance standard of 19 milligrams shall be collected and analyzed by a certified lab. Water meter readings are to be provided with the semi-annual report. If any of the field tests or lab tests fail, follow-up tests shall be conducted by certified lab and an evaluation made by the operator within 30 days. After the required 2 years, testing application can be made to the board or the agent for review and possible modification of the monitoring requirements. The applicant agrees to apply a minimum of 6 inches of compacted topsoil to all disturbed areas of the property. The engineer shall submit an engineered as-built plan, including as-built elevations, with a written certification that the system has been installed in accordance with the approved plan. No alteration to the floor plan of the dwelling or the engineered site plan will be allowed without further review by the Board of Health or its agent. And this variance would be granted pursuant to the State Environmental Code, Title V, and the Town of Chatham subsurface sewage regulations, and is valid from 1 year from the date of the Board of Health approval. A permit must be issued and work commenced during this 1 year, or the variance shall expire.
Okay, I guess any comments from the public?
I don't see any.
Okay, not hearing any. We go ahead and take a vote, probably orally. All in favor say aye. Aye. And all disapprove? No one, okay. So that passes. You're all set, David?
Thank you very much.
Okay, next on the agenda, we have 3 updates. Bob Duncanson is not with us today, so Judy's going to be providing those for us. And the first one is an update on 32 Mill Hill Road.
So briefly, what we have is, you're aware that the RV has been removed, and the DPW just got notification from the company that's going to put up the rest of the guardrail, and they got a date for Tuesday, the 19th. They're going to be completing the guardrail in front of the property. And then the only other thing I can say right now is that last meeting, we talked about reaching out to DEP, and I did send an email today to their strike force team, a person who's familiar with Chatham, and I've met him, so I reached out to him, and I'm waiting to hear back to see if he has any recommendations or can somehow assist us in the matter. But beyond that, we're just waiting for the finished, signage and guardrail to go up.
So you said the no parking signs will continue to the end of the lot as
They're
well?
supposed to. I can double check on, I'm not sure how far they go now, but they're supposed to go, the parking committee, whatever they're called, they did approve them to go all the way to the corner of Dusty Miller. No parking on that side, so.
And then I guess the other issue we talked about was policing. If there's parking there and neighbors or someone has a complaint, I'm assuming that that's a police department issue at this point, once all those signs go up.
Yes, parking and should be referred to the police department.
Okay.
The 2 trailers that are in that roadway there going the right of way, nothing has been decided about how to get those trailers out of there.
Are they on the road or?
Well, they're not in the paved road, but I believe they're still within the town property.
Okay,
And, they're just, there's 2 trailers full of metal and they're registered, and they're just sitting there. And they've been there for
yeah.
a month.
I'm not sure whether we can tow them if they're off the roadway. I'll have to look into that. I don't know what the situation is
If you
with that.
extended that guardrail along the line that the guardrail was on, it would go through the middle of the trailer.
Okay. I will make a note of that, and I'll ask the PD what they can,
And then where the guardrail is where there's a big slope going down to the home. And it's really good that there's a guardrail there, because if you went off the road there, you'd go down a very steep slope, so that's like a good place to have a guardrail. But beyond where the guardrail stops, there's a lot of trash that's that's visible to anybody driving along the road, and so it continues to be unsightly and.
the guardrail is going to be continued to the end of the property, I believe.
Right, but because of the configuration of the property, that all the trash that's on the property at that end of the property is up high where it's visible, even if you look, if there's a guardrail, you'll see all this trash
Right.
on the other side of the guardrail. So that has to be dealt with,
Right. Well, that's
at some
right, and
point.
that's the next phase of dealing with this, and we, baby steps at this point.
Yeah, are you saying we're going to start dealing with his house in his yard? Is that what we're going to do the next step?
Yeah, I thought what we had said before was we would finish the roadway part, which means get that guardrail up, get the parking signs up, establish that the police are going to handle complaints. And then when that's done, which we're close,
Yeah.
then we would begin the next phase, which is the property. And Judy has contacted the Mass DEP to see if they can help somehow, but we want to be careful of how they get involved. And then it would probably be an inspection with a whole group of people to look and see what's actually there. and then a discussion of what should or shouldn't be done and how much.
Right.
So
So that's the
that's
next
the process.
phase. And that was the process that our town council, recommended we go through. And
We'll go up there as a board.
I would guess we would ask how many board members want to go, and I'm assuming most will want to go, so there'll be a quorum, so it'll have to be a meeting, and then there'll have to be police, I would guess. You'd have to have the fire department because it's been called a fire hazard. Maybe some outside help, and then Judy and Bob. So there'd be.
All right,
be a
thank you.
group.
But it would also be nice if the town council would delineate what the responsibility of the Board of Health is. Because if it's unsightly, but there's no vermin and there's no liquid waste or anything on the ground, and it's a nuisance because of its appearance, is that a Board of Health issue? Or is that a zoning board or, but where does the Board of Health responsibility come in when it's a problem of unsightliness?
So you're saying before the inspection of the overall
Well, I would
property, we'd
just-
get more input from the town council as to exactly what we can and can't, or should or shouldn't deal with?
If it's
Yeah,
a
that sounds-
nuisance because it's very unsightly and it degrades the value of the adjacent property, and the guy on the adjacent property can't rent his house because it's so unsightly, is that a Board of Health issue, or is that a selectman issue? Or,
I mean, I think
what's
the
the
board,
health implication of that?
Board of Health has already basically determined that it is a nuisance situation. And I believe we have the authority to move forward with that. And that's kind of the road we've been on, so, and I think town council has backed us up on that.
Yeah, I think Pat Costello said, this is, in the state law, a nuisance, which this is handled by Board of Health, so we have the authority. I think
That's
the
why
way
we're
you're-
handling it and the selectmen aren't handling it.
Wonderful, if that's the
Well, there's
case.
different issues. I mean, one is the fire department issue because of that.
And I believe when we do a survey of the property, it will be with the fire and building department, because they'll be looking for different things, and the things that they're concerned with are our concern as well, because our code is kind of overlapping with them, in that if it's a fire hazard or a building hazard, it is a public health hazard, so.
And then just in terms of the trailers, the trailer at the far end, that's blocking the finishing of the guardrail, so that will have to be removed somehow. And then there's the apron that sort of represents his driveway theoretically, although it drops off. But I think that's sort of his driveway. That's why they didn't put the guardrail there. He has a trailer there as well. What you can do about that, that's a different issue.
Right. I'll talk to DPW director this week and ask him about how they're going to handle the guardrail where it's blocking, and see what their plan is, so that doesn't get jumped over again.
Judy, have you been close enough to see if the house is inhabitable?
Well, no. I mean, the house is being lived in. I have never been in the house. I don't think it would be considered habitable by us, but that's, I don't have the right to go into a private property. So,
A private residence.
a private residence to go inside.
Yeah. But you can tell by the outside anyways, probably.
Yeah, I mean, I know the fire department has some concern about access to the property if they ever have to get in there. That's the biggest concern at this point, so.
Okay, thank you.
Okay, other questions from the board? Okay, that was the first update. The next update is Chatham water quality, and Judy will handle that as well.
Again, briefly, I think Bob has been keeping you up to date on the PFAS situation. Since well number 5, the treatment system has gone on. We've had no detection of PFAS in that well. Well number 8 is not being used. That's going to be if we need it because of running low on water, if we get to that point, over usage. But number 8 is on standby. We are, it's very dry. We're getting close to drought conditions if we're not already there, so the water ban is still in effect, although they loosened it up a little bit, but I'm pretty sure the town and the water department will be keeping an eye on usage this summer, because we are in a dry spell. That's really all I have. It's kind of the status quo right now. The other wells that they're developing, they were still working on the engineering and all of that, so. That's all I have on water quality right now.
Any questions?
I have one question. That company that we were going to hire to track where the FS is coming from, is there anything on that?
I have not had an update on that, so I'm not sure where that stands. I think they had put it out for bid. Bob has not given me an update on that.
Okay.
We'll make sure we get that for the next meeting.
Okay, other questions? Okay, that's the second update. And then the third update, COVID-19. And I guess Judy will handle that as well.
Yep, so Bob sent out some new numbers. Last week, we had 8 new cases. It seems to be kind of steady, not big jumps up or down in the past few weeks. And these are obviously only tests that are reported to the state, not the home kits. Our percent positivity rate is, it's again hovering around 7%. 5% is considered community spread. We were at 7.38, I think, this week. Barnstable County is at 7.02. The state average is 6.04. So everything is kind of, we were up slightly from last week, but not any big amount. And our incidence rate, the same thing, is hovering around 20.8. Hospitalizations are kind of slightly going up with the new Omicron variances. I think they tend to think that it's not because of the seriousness of the Omicron, but the total number of cases. Since we've had a lot of cases, it just makes that, volume more. You're going to have a higher percentage of people that do get sick, but kind of a status quo where we've been for the last month or so. We do have plenty of test kits available for the public, and we've had pretty good response. We've been getting them out there into the community, and I do urge people, if they need them for their families, to just come by the health department during normal hours, and we can give them to them. Nothing too much new with that. Seems like the new normal with COVID these days.
Can we ask for public input with updates?
Sure, yep. I don't,
Questions on COVID? Then anything from the public on the updates of McGrath or water quality or the COVID?
I don't see anyone.
Okay, can we move on to any, just asked for input from the public on any of the updates? Not hearing any, we can move on, and I guess we'll go to additional business if somebody has a comment or something they want to bring up.
Are we going to discuss these cease and desist orders?
We can. We had, this is, and Dick is referring to 2 letters I sent out on rental properties this week. It's becoming an issue. Well, I'm getting complaints from, these happen to come from a realtor who's trying to sell a house next door, and who happened to look at several of this person's listings, and the houses were being listed with more bedrooms than they are approved for. I did speak to, I spoke to the owner of these 2 properties, and she took the listings down and changed them to the proper bedroom number. The problem is that there's not too much else I can do about it, because they're, I can't tell people where they can put beds. These houses have beds in every common area in the house. Lofts, sewing, not sewing rooms, but, porches, landings, 2 and 3 beds in every room. And I don't have control over that. Without a rental bylaw in town, this is just going to continue to happen. People are buying these properties, and one of these houses is being rented at $20,000 a week. And
Sorry, so if the Board of Health has approved a house for 5 bedrooms and it has a septic system, alternative or whatever, that will serve 5 bedrooms, and they're advertising sleeps 16 people in 8 bedrooms, there's nothing the Board of Health can do about that, other than to say, stop putting in the ad, but you can still sleep 16 people and have 8 rooms with beds in them? I mean, that's absurd, you know?
I'm not sure how I can, how I can go about this. I can't.
You say that you are ordered to stop renting this place for this many people.
For that number of bedrooms, yes, which they have. They've stopped.
Well, but there's got to be some way to limit the number of people that are living in this house that are over taxing the septic system.
The only way I know that we could limit this and keep this from happening is through a rental bylaw where we register every rental in town and we tell them how many people they can sleep in that house. And that's based on usually some type of a formula, 2 people per bedroom. Common areas can have, so many people per square footage. It's just impossible for me to police this the way it is now. I mean, this is going on all over town. Granted, it's...
Last year, we had a similar situation. We had a house on Sam Ryder Road that was supposed to have 4 or 5 bedrooms that was advertised as sleeping 16. What happened with that?
We went in, and it's pretty much the same thing. I'm trying to remember. 2 of the rooms that they were advertising as bedrooms were connected to each other, so it really was just one big room. They took some beds out of the basements. We told them you can't rent those, you can't have bedrooms in the basement. It's the same thing. It's just, you can't tell people where they can sleep in their house, but
Okay, so if
legally-
I have a 5-bedroom house and I advertise 5 bedrooms, sleeps 20, that's okay. And I can have 20 people living in that house, and the town's okay with that.
Yeah, I mean, I don't know that I'm okay with it, but I'm not
I mean,
sure
this
I
is
have a lot of
absurd.
control over it.
It was
Unless
just in the
It's different if
Chronicle.
you had a tenant. The short-term ones are really difficult. If it's a long-term situation where you have a tenant who's overcrowding the property and somebody's living there and it's poor conditions and they make a complaint and I go in and I say, there's too many people living here and there's certain conditions that I can cite. But on these short-term rentals, I just don't know how I can go about enforcing any of this. It's just,
The other towns on Cape Cod don't have any mechanism for doing this.
no, they're
In
not,
the
unless they have a
paper this
rental
week-
bylaw. The town of
Yeah.
Dennis has a rental bylaw, and some of the other towns do too. But it still happens. I mean,
In the paper this week, there's an article about Orleans and how people in Orleans are getting very upset that residential areas are becoming commercialized because people are taking large homes and advertising these are wedding venues and party venues.
And that's happening in Chatham as well.
And on a Friday night, there'll be 16 cars in front of a 3-bedroom house and bands out and there's nothing that can be done about this except if there's a noise violation, send the police.
right. It's kind of a
And
situation
all
where
the
it's-
sewage is, the sewage that these people are making is not considered a problem.
it is a problem. I'm not saying I don't
But there's
consider it a
no-
problem, but I think that it's going to take more than just the health department. I think it's a community development issue. I think we need to have some type of a short-term housing bylaw in town where we can control this situation, where we have a set of rules that we can enforce.
Well, can we propose that the Board of Health send the selectmen a document stating that this is a health problem, this is a sewage problem.
Yes.
The state of Massachusetts is now trying to to change the nitrogen loading regulations and go from 40 years to 20 years because it's such a problem. And there's so much nitrogen going into our water. And here we're letting 20 people live in a house with a septic system designed for 4 bedrooms.
6 or 8.
This is insane.
I agree, and
So why don't we formally ask the Board of Selectmen to consider, the Select Board, to consider a regulation regarding the number of people that you can put in a rental based on the number of approved bedrooms. So if a house is approved for 4 bedrooms, they can't have more than 10 people in the house.
I think that we should put this on our agenda and have a formal discussion.
Yeah, I think we should, Dick, I think we should make this an agenda item, because it lumps in with bathrooms and the rooms, the number calculation of total rooms in the house, and
Well, this is a different issue. That's a different issue.
well, it's all the issue of overcrowding of houses.
I mean, the definition of a bedroom is separate, and we do have control over that. But I think
Right.
this other issue is more of it's the need for the town to have a housing or a rental bylaw, short-term rental bylaw, and that it would need to be supported by the town. We would need, it could support itself because we could charge fees, but we would need staff and almost a whole department just to do it.
Yeah, but I think it does get into the issue of whether these amorphous rooms are actually being used as bedrooms. That's, to me, is the basic issue. But let me ask Judy a question. So if your note actually says an inspection of the property, but you do have the ability to actually walk in and look.
Yeah.
I assume. Now, if you walk in and you see an office that has beds in it, can you tell them, well, this is an office, it's not a bedroom?
I mean, if it doesn't meet the definition of a bedroom and it's got 2 day beds in it, I don't see how I can tell.
So as it stands now, that's not something that you do. I think that's something that we have to discuss and sort of figure
It's
out a
like
way
these
to
are
police
2
that.
separate issues. One issue is how many rooms can we approve when they're constructing a house or renovating a house?
Right.
How many bedrooms can we have in that house for that size septic system, and what's the definition of a bedroom? Then the second problem is, if a house is defined as having 4 bedrooms, can they rent that out to 20 people? That's a separate issue, and yeah, that's
And again, I feel that's not just the health department, that's community. We're going to be having a new housing director in town, so I think it's a good topic that we should be
And
bringing
Bob might
up
know a lot.
at a department head
know a lot more
level.
about that, Ron?
Judy, we tried this before. Do you remember when we did that?
There's been discussion
Diane,
over
do
the
you
years
remember when we
for
did-
different reasons, but yes.
No, we did it for the same thing, because I remember people, someone in town sending us stuff saying, this place is only a 3-bedroom house and they're advertising it as a 5-bedroom. And we wanted to do that, and we looked into it.
Yep, but it never
Well,
got
they were
past
shut
the,
down by the selectmen.
Right.
Not do it.
well, I think that we should put this on the agenda and have this discussion and then formally send this back to the selectmen. I think they are starting to hear it more now, because this year's been crazy with these complaints, and
Well, now you mentioned
Carol, yeah.
one of these properties, you spoke with the Realtor, but I'm sure they're
No, I
rented
didn't
for
speak with the
whole
Realtor.
season.
they are rented. Both of them, I think, are pretty much rented out all season.
Right.
I spoke with the Realtor who was selling like the house next door,
Oh,
who was upset.
oh, I thought you
because-
said you spoke with the Realtor and they removed,
I spoke to the owner or
The owner.
Yeah, yeah. They just removed the listing as 8 bedrooms.
but it's already booked for the whole season.
Yeah, but to Dick's point, so they removed the listing, but they still have the same number of people sleeping in the house.
Yeah,
Yeah,
no,
we've-
I
we've-
agree.
Yeah, I
Believe me,
know.
it's a frustrating situation, but
But
I mean, I
think
can
the
talk to
bottom-
town
bottom line is
council.
It's a major issue, and we need to get an agenda item, whether you make it two separate items or one.
Well, I think it should be two. I think
And
what
then
we
get
can do
more-
today is we can propose that we put together for consideration at another meeting, a modification of the definition of a bedroom that would solve some of these problems where we look at a room and it's clearly designed to sleep people, but it's not called a bedroom. And it doesn't, they shouldn't be approved because the septic system isn't sufficient for what they're doing. So what I would propose is that we, in addition to our current definition of a bedroom, we add the Title V-based bedroom calculation, which is done by taking the total number of rooms in the house, dividing by 2, rounding up to the next integer, and calling that the number of bedrooms. And then for our purposes, the number of bedrooms that we would use to make a decision about approving a variance would be the higher of the two numbers, either the number of bedrooms shown on the plan or the number of bedrooms done by the calculation. And in many of the cases we've seen over the last 3 months, the calculation of taking rooms, dividing by 2, and rounding up would have at least one more bedroom than the number of bedrooms shown in the plan. And we could then legally reject those applications. So if somebody wants to put a giant bathroom with a big shower and a big bathtub and a double vanity on an office, well, when you count that office and all the other rooms, you get 11 rooms in the house, then that's 6 bedrooms, even if it only shows 4 on the plan. And so if they're asking for 5, it would be rejected. So, Orleans, I believe, uses that calculation. So we could use that calculation, or we could use our current definition of a bedroom and say whichever of those two methods yields the higher number of bedrooms, that's the number that we would accept in terms of deciding.
We can revisit that.
So if you could kind of make up a modification of the definition of bedrooms, and then we could consider that.
Yeah, so that would be one agenda item relating to the number in the house, but you had another one besides?
No. So this
Because maybe we would have.
variance today would be rejected because it's 11 rooms, which would be 6 bedrooms, and the plan shows 4 bedrooms.
Well, for myself, I have to say, I'd have to look at those numbers and look at plans and in my own mind, see how it actually works out. Because to me, there's questions. Do you count the basement rooms, when you have great rooms? and
It's
they're
livable
multi-
rooms. I mean, you can go to the Orleans.
There are several issues around there as to making the calculation. In my mind, it's not that simple, but I sort of have to sort of look at it. But I think what we should do is make that an agenda item so we can get more information or some kind of a starting point, and maybe some information from what other towns have, and talk about that.
If you look at today's plan, every room has a title on it. It's great room, dining room, kitchen, 3 bedrooms, office, and study, or whatever. You add them up, it's 11 rooms. That's not 4 bedrooms, that's 6 bedrooms.
And then there was another.
They don't have to build 6 bedrooms.
Huh?
Right.
I don't see
Well,
why it would.
the point is, in many of these
I
plans.
think what Dick is saying, that would scale down the size of some of these houses that are being rebuilt, so.
Right,
Can we enforce that?
yeah.
I think we can, but I really think we need to have this discussion.
the
at a
I think we
public
need,
hearing
at the
that-
next meeting, we need an agenda item to discuss what Dick is talking
Yeah.
about, maybe with some more information, and be prepared to make some kind of proposal. But I think it's complicated, and I think that the definition of what rooms you're counting, and you have to have clear in your own mind and run through some
Yeah,
scenarios.
it's not halls, it's not staircases, it's not garages, it's not basements. It's rooms that you can live in, you know.
It's not
I think
based,
it just excludes bathrooms
based.
and the stairways and
excludes
hallways.
bathrooms.
Yes.
But, you know,
Great rooms are an issue, I
last
think.
week, there was a house that was 11 rooms, 4 bedrooms, on a 15,000 square foot lot that would, for new construction, only be approved for, even with alternative, for 3 bedrooms. I mean, it's crazy what's going on here.
I'm going to resend you, so you can review it, what I had put together when we began the initial discussion about bedroom definition, and then we'll put it on the agenda and then at the next meeting and talk about that. And we can also, as a separate item, talk about the rental situation and how we want to make a recommendation to the select board is what I would suggest.
yeah, that's.
You get the
that's what
Orleans-
I would agree that we have 2 agenda items. That's 2 separate issues.
Right.
Okay, I'm going to send that to
Can
you.
you get the
right-
Orleans,
I have it, yep.
how they
I s-
define a room?
I think I sent all that to you, but I'm going to resend it right now.
And then you said the town of Dennis has such a bylaw?
A rental bylaw.
Yes. They have rental bylaws. A few of our other towns have rental bylaws as well.
And then who enforces it?
Provincetown has it too.
They have separate, they have separate staff that,
Separate staff.
yeah, there's no way that I can even,
Right.
you know,
So, yeah, so it's definitely
run a
select
rental
board type
program.
thing.
It's a full-time job, it's an administrative thing, it's, you know,
So, but we'll plan to put 2 agenda items on, one having to do with revisiting bedroom definitions and the Title V review of the total number of rooms and how many bedrooms are allowed, and then a second agenda item of heading towards perhaps a rental bylaw to control the overall number.
okay.
And we'll gather,
good.
and then Judy will gather information, and we can move forward. Okay, so additional comments or business or? I had one thing that came up, and it sort of dovetails with what Rich is bringing up, Judy, and that is, if we pass a variance, you know, we have a plan for a house with a certain number of bedrooms, and there are bedrooms that look like, I mean, there are rooms that are amorphously named, but they look like they might wind up being bedrooms. Have we ever, or could we, put a additional condition, which would be an inspection of the house, to see if those rooms have been turned into bedrooms? I think you've already answered it, saying you really can't, you don't have the manpower to do that, but is that something that we could do?
Well, I mean, I don't know how, a set of plans comes to me to review for the building permit.
Yeah.
And then I approve it based on what we've approved. But
then when we approve the
And then the building
variance-
inspector goes in and does his final inspection, and if anything's changed, he will come back to me and say, you know, they've finished off
But
this
say,
room.
but say it's, you know, we have the feeling that in a number of months or in the busy season, it's going to be turned into a bunch more bedrooms. Have you ever put in a condition that in 6 months or in July, the health board inspects the house to see how many bedrooms are being used? How many bedrooms are actually there?
No.
I mean, they could close down
I just don't think that's reasonable.
because of manpower or because of legality?
I mean, maybe both, you know.
Okay, but that's a thought I had actually with the whole thing. Dick?
Now, you said if you go into one of these homes, like that we're on today, and they put beds everywhere, so they've got more beds in this house than bedrooms. Now, if they've made a room private that wasn't private before by putting a new door in or something,
That's,
and they've made a new bedroom,
right. They can't do that. They're not supposed to do that.
right, so you're saying if these houses that say they sleep 20, these people are sleeping in wide open rooms, they're not, They haven't put in a folding door to give some privacy to these people
No.
that they're renting to, and we know that.
Do I know that?
Because if they
I mean, I
put
can
in
see
a
the
folding
pictures on the
door,
website. They're
so
they're
they're
locked,
just-
and when you read the descriptions, they'll say the number of bedrooms,
Yeah.
and then they say, you know, loft 1 has 2 twin beds, and the sunroom has, you know, a day bed and a twin bed. You know, they describe exactly what the rooms, how they're laid out.
So the sunroom doesn't have a door on it? Because if it does, they made it into a
Well, it doesn't meet the
bedroom.
definition of a bedroom, if it's a sunroom, because we have specific definitions for sunrooms. But I mean, again, each house is different, so I'm just giving you an example of spaces, lofts, all kinds of places, things like that, you know, that they just put beds. And some of these houses have a queen-size bed and 2 twin beds in the bedrooms. So they're putting, multiple families in these houses.
Now, there is a definition of habitable room, right? You need X number of square feet per person.
Yes,
And these houses are not exceeding that?
I don't know.
Well, we know what the square footage of the house is from the plan, and we know they're advertising sleeps 20.
Yeah,
So it wouldn't be hard to figure out if 20 people in that house exceeds,
well, I'd have to go in and measure.
and then that's a public
So
health
you have to,
issue.
you can't count bathrooms and kitchens and all that in those spaces. It's only for the occupancy per room, it's based on the square footage.
Right,
It's like
so
50
you
square
could go
feet
back
for
and
each
look at the
person.
plan and see how many square footage of rooms they have.
If I
And how
have
many
a plan,
people, if
yeah.
there's 20 people, and they're packing it to
I
the
mean,
point.
again, Dick, I can't spend all my time doing this. This is intensive, and, I mean, we need some kind of a formal program to regulate this. I mean, this is a big problem, or it seems to be a big problem. It seems to be cropping up quite a bit, as you've seen. I've been sending letters out, and I try to follow up as best we can, but it's bigger than just the health department.
Does the town have an ordinance regarding the number of automobiles that can be parked in front of a house?
I don't know.
Because some of these
I don't
houses
think
must
so. I think
have
it's only
10 cars.
unregistered vehicles, and cars is a police department issue. When people call about noise or cars, I tell them to call the police department. So, I'm not sure. I know there's only 2 unregistered vehicles allowed, I believe.
Right, but if you've got 20 people living in a house, say you've got 6 cars out in front of the house, does that, maybe the police could take note of that.
Yeah.
I don't know, it just sounds like
Again,
we've
it's
got-
a community-wide problem. It's not just the health department. It's police, it's building, it's fire safety, so.
But I do think after we have a meeting and 2 agenda items and discuss it further, alerting the select board to the fact that we're concerned about what's happening and we think something has to be done. We may not know exactly what it is, but it's going to be perhaps involve more than just our board to get it done. I think that's that kind of a thing.
Can I ask one more question?
Sure.
Once the town is sewered, once a street is sewered, what does that sewerage, how does that affect the Title V, the bedroom numbers?
They're only
in the
allowed
house?
to have what they are allowed under our Board of Health regulations. So if they get sewered, they're allowed 1 extra bedroom. But if they've already received the 1 extra bedroom, they don't get another bedroom.
So if you've got an alternative system and you've gotten an extra bedroom,
That's it.
that's it. You can't put,
They're deed restricted to that number. And that was done, purposely,
yeah.
so.
And they get, the IAs, they get 10 years to use it before they have to hook up too.
Right, but they can't say, okay, I hooked up to the sewer, so now there's no nitrogen problem, we can put 12 bedrooms in the house.
Right.
One last thing. I've been told, I don't know, other towns in Massachusetts have addressed this and have set up a strict way of looking at this sort of thing. I don't know a specific town, but we've looked at it on Cape, but there may be something outside, which is something to keep in mind, I think. Okay,
I have talked this over with our community development director, and, she agrees and sees that there's issues, because it's a building department issue too, because these houses are getting overused, and they've done things, some of them, I mean, not these particular, but they've done things that they weren't supposed to do, they weren't on the building permit.
so community development has been dealing with these exact issues?
With me, I mean,
With you.
when I get something like this, I send copies to them, I've gone in and looked at houses with them, and so it's, it's not just the health department that is concerned.
So when this person who complained about the house being advertised as Sleeps 20, all we can say to that person who complained is, there's nothing we can do about it other than have them remove the part about 8 bedrooms from the ad, but they can still say House Sleeps 20. Have a nice day living next to this
I mean, I
house.
recommend that, I told them that I would contact the owners and talk about it, and that,
Yeah.
I always recommend that they talk to the community, the people in charge, and make recommendations. Sorry.
All
I
right.
turn that off. So, yeah, it's a difficult situation. That's all I can say at this point.
Further comments, questions? Okay. All right, so we'll deal with that a lot in the future. And I guess we'll move on to the next item, which is the minutes from our meeting of June 27th. Any revisions or additions? And if not, maybe we can get a motion to approve.
I'll make the motion to approve.
Okay, motion to approve, and then a second? A second? Can I second it? Yeah, I'll second it. Okay, a vote to approve the minutes from June 27th. All in favor say aye.
Aye.
All opposed say no. Okay, the minutes are approved. And I think we're ready to adjourn the meeting.
Guess that's it.
Can I get a motion to adjourn the meeting?
I'll make a motion to adjourn the meeting.
And a second?
I'll second it.
Second. All in favor say aye.
Aye.
Aye. Okay, well, the meeting is adjourned.